So that was the last presentation from the recipients of the capacity building grants, but as I said earlier today, this process was as much about building capacity and learning about evaluation, what works, what doesn't, how we make it better, how we build the evidence base, as it was about starting to build the evidence for what works. So this next session is going to be facilitated by Kantar. So all of the grant recipients in this program received a grant of $30,000 and then they were matched with Kantar, who supported them in developing evaluation capacity building and understanding the best way to collect their measures and design it. So I'm going to invite Kizzy and Sarah from Kantar up to sit at the table for a panel discussion, and then there's representatives from Catholic Care, Shark and West Coast Youth and Community Support who are going to join for the first part of our panel, and then we're going to swap the panel participants over to people from the second presentation. So if all of you would like to come up to the stage, I'm going to hand to Kizzy and Sarah to take us through this next part of the agenda.
Hello. Can everyone hear that okay? That's louder? We can share a microphone, Hayley. Hi everyone, so my name's Sarah and thank you for the introduction, Erin. I work for Kantar Public and we've been very honoured to have the opportunity to work with all of these organisations. We've been conducting workshops and catching up on quite a regular basis with all of the grantees to help build their capacity when it comes to evaluation. And I think we've been working together for about 10 months.
Yeah, and it's been really nice to see each other in person and see how tall you are.
I was saying that's always my favourite thing to do, is to see if people are taller than I expected on Zoom. So, no, it's really great to be in person. It's great to be here today. So I've loved all of the presentations this morning. I think it's amazing having that background knowledge, working with the grantees over such a long time, to just see how far you've all come and what everyone's been able to achieve. It's been really amazing. So great presentations this morning, and I think this is more of an informal opportunity to just hear about your experiences and what you've learnt and what's gone well and what's maybe not gone so well, and plans for the future. So this first session today we'll be talking about kind of theory to practice, so learning evaluation capability building and how that's translated into reality. So before we start, I might just let everyone introduce themselves again, just in case anyone's joined online and missed that earlier. So if you guys would like to.
Hi, I'm Hayley. I'm from West Coast Youth and Community Support in Port Lincoln.
Rob Campbell from Family Drug and Gambling Help at Shark, Self-Help Addiction Resource Centre.
Lauren Cadwell from Catholic Care, Sydney.
Thanks, guys. So the first question I have, and I might just mention, I'll probably ask a few questions up here and then we'll open to the floor for anyone online before we finish up. But my first question is, how was the evaluation capability building program, the boot camp, the training sessions that we did, how is that different to the reality of implementation? And perhaps we'll start down that end with yourself, Lauren.
Yeah, sure, thank you. Look, the boot camps were really practical, skills-based and competency-based, so it actually made the implementation really easy because we got to practice the skills in the boot camps around how we were doing the analysis, how we were doing the theory of change, so it made it really smooth.
Yeah, fantastic.
Thank you.
And what about yourself, Rob? Was it different?
Look, echoing Lauren, I think as with anything like this, it's looking at the big picture and then bring it back to how to make that real in the evaluation of what we're seeking to do. But certainly fantastic skills and information given through Kantar. Yeah.
Fabulous. Hayley, was anything unexpected? Was the training different from reality?
It was actually really quite, it matched it really well, and that's a testament to you guys, I think, at Kantar. Yeah, it ran really smoothly.
They're all very kind and generous responses. But I guess then, just given that it sounds like from each of your perspectives things went well and the training adequately prepared you. Is it
5-star Yelp review for sure.
okay? But did you have I guess, out of curiosity, a favourite part of the evaluation? Thinking back, the program, the journey, and just implementing the evaluation.
So I swapped over with a colleague who was
Yes.
taking carriage of this evaluation first, and I know that she really loved the theory of change component because it really, for her, helped to sharpen the links between the activities and how they met short and medium and long-term outcomes, but to really break it down, through the service activities, the evidence-based activities, and how they would lead to that. For myself, I love data and I love analysis. So of course, I loved when I got to come in at the analysis and report writing stage.
Yeah, tie it all up.
Tie it all up together, and really, I think what was really valuable for us was to have that information and those findings to then work with our service delivery staff and our practitioners, really, to have conversations around how, the information that we gleaned could help them make decisions, data-informed decisions around service innovation and continued service redesign. And, for some of our practitioners that don't have much of a research and evaluation background, I think being able to, see the cycle of that and particularly come on board with a culture of outcomes-focused work as being, helping us be really accountable to clients, helping us to understand the evolving and changing needs of our clients. I think that was really a valuable outcome of this evaluation capability project that we were involved in.
Definitely, and I think that's reflected with us all being here today, that it's such an important part, collecting the evidence, but then how does that translate to service provision? What about yourself, Rob? Did you have a favourite part of the evaluation process?
I would say definitely the theory of change, because we're so busy as working in the field doing the work, and doing an evaluation gives us the opportunity to actually step back and see what it is that we're actually seeking to do. And thinking about a theory of change and the evaluation questions was actually very difficult, really drilling down to what was it that we wanted to understand. And in retrospect, I may have changed some of those things too. But that's a journey. I think that's the value of that process.
Could I also add to that comment? For us, I just reflected that for our practitioners, having a theory of change and a program logic really served for them as a lighthouse, because it was really interesting. I think if we talk to some of our staff, prior to doing the theory of logic and program, the program logic and theory of change, there were some slight nuances in terms of what they thought were the primary outcomes and aims of the program. So to be able to have it on that sort of a blueprint of this is what your program does and this is the intended outcomes and how we can measure it for you, I think really helps to support the practitioners around their program integrity and having a collective focus around what they intend to do.
Definitely. And I think that's an important part of doing the theory of change as well, and looking at your program logic, is getting everyone on board, your clinicians, and making sure everyone is on the same page. Yeah, exactly. What about you, Hayley? Did you have a favourite part of this program?
I did like that bit, but my favourite part was probably workshop 3.
Okay.
Yeah, the evaluation.
What did we do in that workshop?
Evaluation planning.
Okay, yeah. Before we went away and did all of our data collection? Yeah.
So just putting everything into context with the rationale and having that all set out was really useful for me.
Yeah,
I felt like I was ready to go and collect the data after that.
Yeah, that's awesome. I'm curious to know, I understand all of the organisations that participated maybe had different levels of existing evaluation capability and even data that was being collected internally. So I'm curious to know, did participating in the program, have you changed any of your data collection processes, your systems, and the way you go about doing that? And Lauren, we can...
Sure, yeah, a couple of things. I think one thing that it made us really critically think about is that a lot of our outcome measures are also used clinically and can be really informative for clients and can be a part of their care and their care planning. And a number of our clients like, for example, to have wellbeing measures that can also support them to track their own progress and review and see how they're going. So for us, when we're thinking about choosing measurement indicators, I think bringing our clients increasingly into that. And so not only, picking an outcome measure that will, of course, measure what, the intended outcome of the program, but something that will also be valuable to our clients as well, I think has been one of our takeaways from this, that we want to think more critically about going forward in the future. Otherwise, for us, it was just really around how do we support the implementation of routine outcome measurement. It's quite difficult, and particularly in the busyness of service delivery. So how do we support our practitioners to implement routine outcome measurement and to support that to happen in a way that's really client-focused and doesn't also feel for clients that it's taking away from their session. So in terms of how we support practitioners to explain the use of any sort of pre and post measures, for example, and bring clients on board on that journey as well as bringing our practitioners on board. Having visual process flows, to support the uptake of doing it, and even having a systematization in our CMIS to have reminders of doing it at the right time in the client journey. There was another thing I was about to add. Oh, yes, of course. Having some data collection, I guess, adherence and quality assurance and auditing. This is the boring language that my people hear from me in the office, but, it's really great because, we're collecting so much data from clients, and so I suppose just to audit and check that it is being completed correctly so we have good integrity of data, and to reduce the amount of data cleaning that we need to do by the time we get to analysis and reporting. Those are some of the implementation things that have come out of this capability project that we've been thinking about improving, enhancing.
That's great. Data storage and data cleaning is not a fun thing to talk about, but it's definitely
so
important.
Critical.
What about yourself?
So eloquent. Apart from saying ditto, for us, I think it just reinforces the importance of beginning with the end in mind, thinking about also how to convey what findings we're experiencing to the families themselves, which we tend to sort of keep that information more internal, but to actually see, visiting websites or the social media, what difference certain programs are making or the significance of engaging with support. And it's so lovely hearing everyone's presentations because we're all on the same page, and this just validates the valuable work about how to best capture and celebrate and promote that. So I think that that's something for us as an organisation to think about, not just family drug and gambling help, but Shark more largely, because it's a growing organisation with so many moving parts, how to integrate a sense of evaluation as we move forward. So it's got us thinking a lot, but we know there's a lot of work ahead, and I find that daunting, but ultimately it's for families and how to celebrate the good work that we do, and I think that's what we have to come back to.
Yeah, that's a great response. And Hayley, I know you're right next to me, but what about for West Coast?
Yeah, we haven't integrated it much yet, but we do have a new CEO that started about a month ago, and I was explaining the capacity grant to her, and she got incredibly excited. And we have about 3 programs that are quite new at our organisation at the moment. And I feel very confident now to think about how we should go about evaluating those. Excited.
That's really positive. I know evaluation is a big task as well. So maybe Hayley, I'll start by asking you, but it's a long process. Was there a particular stage of the evaluation journey that you felt like you needed the most support?
Yes. So as I said in the presentation, we changed from an outcomes evaluation to an appropriateness evaluation. So we'd done quite a lot of work, several months I think, and then we realised that wasn't going to work. And Kantar and the ADF wrapped around us at that point and set us on the path for the appropriateness evaluation. So that was really excellent. Thank you.
And that was a huge amount of work that went into pivoting from.
But the second time round, it was so much easier.
Okay,
so that was good for me. I got to see both processes.
And that's the silver lining, I guess, is that now you have the skills to go away and apply those different types of evaluation. Rob, did you find there was a particularly intense point in the evaluation process?
Intense is a strong word. I think we, at each point of the journey, I think that there was really valuable input from Kantar. So I think getting, like I said at the beginning, sort of getting a bead on what we were really wanting to focus on was really important for us to get that extra support and insight around how to make use of the tools and the metrics. But through each of the stages, we encountered different issues around recruitment, how to make most of, how to articulate certain findings and how to do that well. So each of those areas was a challenge, but Kantar's input was always fantastic in supporting us.
lovely. And anyone who's done evaluation knows there's always issues and challenges that pop up along the way. So it's just about being adaptive, isn't it? Yeah. What about yourself, Lauren? Was there a point in this process that...
Oh, look, adaptive is a good word to use with COVID and COVID lockdowns. Because our service delivery had to pause during some of the various lockdowns that we had in New South Wales, it was really valuable to work with you to think about how we could use retrospective data, because we weren't able to get new data apart from doing qualitative interviews. So that was really useful to think about how we needed to pivot in our evaluation design. And how we could still match it to some of the evaluation questions. I think, unfortunately, because we weren't able to do the direct service delivery, it meant that we perhaps couldn't have designed our evaluation in a way that enabled us to answer key evaluation questions 4 and 5. But that just means that we have now future opportunities, to do that next, now that our service delivery is back and running.
Yeah, you've got the plans in place.
Absolutely.
And I think that was it was a difficult time to conduct these evaluations with COVID, but I think everyone handled it really well and found different ways to overcome recruitment issues and all that kind of stuff. I might just ask one more question of everyone, and then I'll open up to the floor and to anyone watching online. But if you were to speak to someone or an organisation who was starting out on their own evaluation journey for the first time, what piece of advice would you give to them?
I would say bring all of your people on board, because, whilst there was perhaps 1 or 2 of us attending the boot camps and leading it, I mean, for example, we have about 30 managers across our division in different areas and 270 practitioners. And so I think bringing all of your people along this journey of what it means to be an outcome-focused and data-informed service that enables us to be client-focused, that enables us to do service redesign and innovation and continuous improvement. So we, for example, after we came out of the boot camps, we set up some of our own workshops with our leaders about program logics and theory of change and the selection of outcome measures, which really helped them to understand how this helped to articulate the way their program works and how it leads to intended outcomes, and bring them along on that journey around also how do we discover outcomes that are not just meaningful for our funders and stakeholders, because obviously we have contractual outcomes that we need to meet, but also how we can understand from our clients and our communities what outcomes are important to them, and be accountable to that as well when we design our evaluation framework. So I think where there's this opportunity, to have, be a part of an evaluation capability, I think about how you can both share the learnings of that with staff and how, staff can utilise it, even practitioner and service delivery staff, how it relates to their work and continuous innovation, and support that cultural change around becoming, outcome-focused organisation.
Yeah, I think that's such a big part of it, is ensuring that you have buy-in internally in the organisation. I think it makes a difference to the success of the evaluation and being able to translate that into service provision. Rob, do you have a comment on that?
Also, too, the importance of time. These things take time, heaps and heaps of time, and lots of thinking time, lots of Tim Tams and headaches, and need to reflect on things. I think also, too, as Lauren's saying, intellectually you think, yeah, we'll get this and we'll run it out, but it takes time also for the team to come on board, for them to actually understand it as well, because it's not that they can't understand it, they don't understand it. It takes time to create the headspace to look at that stuff and really allocating the time. So that's a learning for us. We talk about it in staff meetings and emails and things like that, but to really get people on board is something it's a huge investment, but worth every penny. And also, too, you can never estimate how long it's going to take or how difficult it is to get participants to actually engage in the very study you're seeking to evaluate. So again, how to think about that in as many different creative ways as you can.
Lots of important tips there. Hayley, did you have a piece of advice you would give to someone starting out in evaluation?
Yes, probably 2. Start early, like they've said, because you don't know if you're going to be able to follow through with your plan or not, and it's better to know early. Secondly would be to test your interview questions really well. We tested them a little bit, and then we started doing the evaluation And about 5 interviews in, I realised that our interview questions for key evaluation question 4 about advertising were just producing generic responses that didn't really give us much. But yeah, that's something to know for next time, I guess.
So that's something that you would implement if you were going to do another evaluation, maybe pilot testing some of your discussion guides or survey.
and you need to do it more than once or twice, I think, before you can really see the answers.
Yeah.
I'd add to that too. That's our experience as well.
In your survey questions?
Just in the focus groups and the questions and the survey questions too, just to get the most, to drill down to the best answer that you're really seeking to find out about.
Yeah.
Yeah.
Lauren, is that something that you did or do in your evaluations for Catholic Care, pilot testing of survey questions or...?
No, because we were using retrospective survey and depression, anxiety and stress scales that hadn't been completed, so we didn't get an opportunity to pilot those as an outcome measure or to perhaps refine some of the survey questions that we might have wanted to ask.
Yeah.
Yeah.
Wonderful. So perhaps we'll open up to the floor. I don't want to monopolise everyone's time, but are there any questions or comments for the organisations?
It's great to hear the feedback around the process, because that was such an important part of what we were trying to achieve and really hard to do for all the reasons you talk about: time, resources, focus, COVID. And you've talked a lot about the support you've got from Kantar, and I'm interested to understand whether there was a benefit of the group, of learning from each other, collaboration across scene, learnings, whether that was something that happened through the process or whether you're actually seeing more of it today, right at the end of the process.
I'd say the latter. Like I said before, it's all actually sitting here and realising how many similarities there are, and I think perhaps more opportunity for, there were the workshops, of course, but the meetings separate from those to just track how people are going and almost having these conversations, knowing that this is what it would be a leading point to, would be useful. Yeah.
I think it definitely would have helped if the workshops were in person. Would have made a huge difference. But it was nice to have seen some of these faces before coming here today. Yeah.
Thank you so much for your insights. It's been really interesting to have a listen. I was just wondering, when you were talking about your collaboration within your team, how many people were you working with to produce this evaluation across the whole period? Was it a lot of team collaboration involved?
So for us, we had, I think, I'm looking to Eva, but she can sort of give me the fingers over here, because I came into the evaluation a little later. 5, okay, thank you. We had 5. So we had some support to transpose, our DAS and our survey information onto an Excel spreadsheet for analysis, and then we had another person that supported us in the recruitment of the follow-up surveys and the qualitative interviews for us. And then I led the analysis and reporting of it, so that's 5 in total.
For us, approximately 10, but we also have the helpline, which is staffed with up to 30 volunteers. So it was having them being on board as well, because they would be the ones who would be then talking to the callers to see if they'd be interested in engaging in the evaluation as well. So that was another added step to get them on board and to ensure that they remembered to ask the question. And of course, if a family member is in distress, you're not going to say, now, we've got an evaluation for you to do. It's all about the timing, and everything's about timing in life. So, and that was the skill. And I have to say, the volunteers and the same with FDS are amazing people who come obviously with their heart, but are skilled and trained in what they do, and just bring such an added dimension to the program.
And you know, adding to Rob's point, you know, in future as we do routine outcome measurement, it'll be our practitioners, you know, who are collecting that information. So we'll really need to invest in supporting them in how they do that in a client-centred way.
And we're a very small organisation. We've got 2 AOD clinicians and 3 AOD workers. Everyone's really busy. But a senior clinician helped with the development of our intended program, and there were lots and lots of discussions about the themes that emerged from the data, and we had admin transcribing, so that's how we managed that.
I wanted to say thanks to the panel. It's been a really interesting discussion, and one of the things that's kind of flagged for me that I've been thinking about while you were talking is this kind of model we seem to have of turning evaluation on and off. You know, like we get a bit of money to do something, so we gear up and we evaluate one specific thing, and then, you know, that finishes and we wait for the next thing. Just wondering if you had any comments about, you know, whether there's potential or what it might look like to kind of be continually doing evaluations. You know, so we build up, particularly around data, I guess. You know, we build up really nice data sets. Can we then, you know, just sort of almost build a sort of continuous learning culture?
Yeah, absolutely. Great points. I mean, for us, we're really wanting to set up routine outcome measurement that is continuous throughout our service delivery ongoing, because that means we can also align it to the demographic data that we're reporting on, and we'll be able to also answer questions around are our services accessible and inclusive to different communities and cohorts that we're working with. So you know, there's a clear value in having ongoing measures of the impact of the service and its performance for our continuous improvement mechanisms.
We need to do this. We've got a few new programs, and one of them is a healing centre that's open 3 days a week, and it's only been open since September. As yet, we don't really have any outcome measures apart from client feedback, which is fantastic. So we just really need to make time to have a real think about how we might measure those objectively.
We probably have time for maybe one question, if anybody has one. Pretty good timing.
Okay, not bad. Thanks, guys, and thank you again.
Thank you.
So, thanks from our panel speakers. Great to hear from your learning. So, Kizzy, I'm now going to get you to come up. Is that right? Yes. Okay, I'm getting to get together. And us representatives from ACSO, Little Dreamers, Odyssey and Uniting, if you'd like to join for the second part of the panel, where we're going to hear a little bit about catching the evaluation bug, knowing what you don't know.
Do you want to? You can squish the mics closer.
Yep.
One more here. Hi everyone. Can you hear us okay? I'm Kizzy Gandy. I'm the National Director of Program Evaluation at Cantor Public. So with my colleague Sarah and other colleagues of ours who are not able to be here today, we've been loving working with this amazing group of people to support them on their evaluation journey. And as you heard, Sarah was discussing sort of the reality of, you know, capability building. Always sounds good on paper, and the polished presentations that you saw behind that was a lot of challenges. And this panel is more about, you know, what's next. So as the question from the floor came in about continuous evaluation, the point of this program was not just to do one evaluation, it was to get everyone hungry to do more and to change mindsets and to instill confidence to be able to do that. So we've titled this Catching the Bug, not the COVID bug, the evaluation bug. And so here we have a number of our participants. So I'll just get you to introduce just your name and your organisation for the... Yep.
I'm Brett Anderson from ACSO.
I'm Madeline Buckner and I'm from Little Dreamers.
Mish Kumar Johnson from Odyssey House.
and Keryn Ralph from Uniting AOD.
Great. So the first question I've got is, as you're going through the capability building program, and we've been calling it boot camp, how has that changed your day-to-day approach in your organisation? What looks different now to what you were doing 9 months ago? Do you want to go first, Brett?
Yeah, sure. We're lucky in that Kelly, who did the presentation earlier, and myself are a part of a new little team that's started in the program or in the organisation that focuses on service implementation. And I suppose the flow-on from that is not only implementing a service, but seeing it through and checking, program fidelity and also evaluation. There's only the two of us, and it's a really massive organisation. So we're kind of like grappling with how to do that across the board. So I suppose the sort of things that we've started implementing from the actual boot camps, the other thing to say is that neither of us have got an evaluation background or training. It's usual community service stuff, just try to bring people up and try to fill some positions and things. So the whole program has actually been really helpful for us because with the assistance of Angela from Kantar in particular, a big shout out to Angela out there in online land. But the things that we've really taken on board is not only the processes, but trying to look at the culture within the organisation around evaluation. Because when we were doing this particular evaluation, some of the barriers that we encountered were around, staff involvement, staff, really wanting to focus on what they do on a day-to-day basis and being time poor and not really having enough time to do some of that other work that is required to support the evaluation. But the main thing, I suppose, for us as an organisation is we're slaves to our contracts. And so everything we focus on is always about throughputs and outputs. It's not about outcomes. Staff will have that in their heads and it'll be in program manuals and things, but because staff are just totally, entering data all the time, just focusing on, how many people are attending a group and those sorts of things, what this has really done for us is we've actually started doing program logic models for all of the programs in our organisation, not just this particular program, and involving staff in the development of that in each of their programs in order to really shift the focus from outputs to outcomes. And I'm not sure about the effect of that, but that's one of the things we've really, that this has really assisted us with. The other one is just the usual stuff like, how to develop those theories of changes, but also about being really sensible and not overcooking them, because that's what we did in this particular evaluation. The first one that we did with you guys was that we actually overcooked it, and we got halfway through and went, oh my God, this is just too big. Let's strip this right back.
Yeah. So I think what you're saying is, on the main thing is you've moved from thinking just about bums on seats to what's the impact of your program, and how can you sort of communicate that and simplify that for everyone to understand across your organisation, so that everyone's got that single goal about outcomes.
Yeah,
that's huge. That's not small.
Yeah.
What about you, Maddie?
For us, I guess we've learnt kind of two key things. Like you, we also don't have a massive team. We don't have anyone whose sole responsibility it is to do evaluation. It's it needs to be a joint, all hands in kind of effort. And so through this project, we've realised just how important collaboration is across our team. So you can have one person who is your project lead, and in this case we had G, who was up here before doing her incredible presentation, and she was leading the evaluation for this particular project, but it's important to then be collaborating with our program coordinators on the ground delivering the programs to make sure that they are actually embedding and delivering the evaluation. So it can't just be one person saying we need to have evaluation and these are the surveys, but you need to also bring on board the rest of your team throughout that process. And the other thing we've learned and that we've now learning how to implement is around actually embedding that evaluation into the design and delivery of the program. So rather than just tacking it on at the end and going, here is a post-evaluation survey, this can tell us that our kids have enjoyed our programs and they want to come back. we actually need to design a full evaluation project, which is what we've learned how to do, and embed it into how do we design, develop and deliver our program to make sure that we can actually get significant insights rather than just the 85% of my kids say that they want to come back to the program, which is great and it looks good for funders, but does it actually measure improvement in quality of life? Probably not.
That's awesome. So again, I guess what you're saying is you're thinking more about outcomes, and you've had that mindset shift, and that's maybe one of the day-to-day changes you notice.
Yeah, definitely.
Awesome. Mish, have you changed anything day-to-day in your work?
Not at all.
I knew you'd say that.
Yeah. We all have, actually I don't have a substantive role, but it was pretty much a team of 3. The other 2 people have substantive roles. And I think it's really difficult to go from being a clinician and thinking about the work and thinking about how do I get this person to engage, what forms I need to fill, etc., to I need to evaluate. Like that's going from micro to macro really quickly. And I think part of the capacity building for us was just small mind shift, like tiny mindset shifts if we can. And one of that is, as a clinician, I can do evaluation. Like that's a huge thing, you know, for clinicians. It's often, I know my clinical work, I will go to work and do that. And I think this was a really good program. So it was mainly Chris and I worked 1 day a week on this, and, you know, on top of Chris's job as an intensive support program kind of coordinator, he had to also figure out how to learn completely new skills, you know, and think in a different way and speak in a different way and write in a different way. And I think, so no, we haven't done any day-to-day shifts, but I think the win here for us is we can do evaluation. And I think that's really huge. It's really empowering, and it's something we can then plan for in the future. It just opens up doors for both of us in other roles and other projects. And for ourselves. So I suppose just small mindset shifts.
And maybe the confidence to ask for the resources that you need in the future to be able to do it.
Yeah, I think going to any job. Yeah, it is. And
full already.
And I think that's something we completely underestimated is how much time it'll take. Completely underestimated. Like the whole thing was supposed to be done in 1 day a week, you know. And I think that's a massive learning for us. And yeah, so definitely the confidence, but also a better understanding.
And yeah, I suppose for us, I mean, a couple of those things, but also it's just, you know, we have a database, you know, we have a data system that we can collect data, and that's great, but I suppose this is about the purpose of that data as well. So, you know, I think when we worked on that, and I think Rob said the theory of change was probably one of the, you know, the key factors for me in kind of going, okay, this is why we're doing things. So, you know, we can collect demographics and collect that information, but why are we doing that? So it's more about that question about why are we doing this, and then extending that to all of our programs that we have in drug and alcohol. We have someone that does evaluation 0.6, but that's across the whole organisation, so it's not a whole lot. But, you know, thinking about how we can utilise that asset a lot better.
Did you change that data system as a result of this, or are there plans to change it?
Look, it's our data system is, we can't make changes ourselves. It's an external agency that has to do that, which takes a lot of time. So, like, you know, I suppose it's just like I said about, you know, with our family program, we have an evaluation that we do with families. But through this process, we've kind of gone, well, that evaluation was sort of for us. It doesn't mean anything to the family members. Like, how do we get something that might mean something to both of us as well? So, yeah, so there's a few sort of procedural things that we want to change. We haven't presented this to our staff unit kind of yet, because we're sort of thinking about what is it that they want to know that might be different from, say, here as well. So, yeah.
Early days, but lots to come.
Yes.
Great. So I guess, yeah, building on what you just said, what are the sort of learnings from the bootcamp, but also from your evaluation that you have shared with the wider organisation? Do you want to expand on what you were saying?
Well, yeah, so I suppose there's a lot of statements, I suppose, that have been made in this room are things that we know, anecdotal information that we know. So we're just kind of considering how it is that we present this to staff to really, I mean, our staff are very invested in family work, but how do we, you know, do we provide numbers and data? Will that help them get more invested? So I think it's just, we need to think about our staffing group as well and how we present that and what will be the kind of key information that we need to deliver to them to really grab their attention, I suppose, and continue working with families. And then the other part of that, I suppose, is looking at, you know, we've heard today, you know, tenders and, you know, funding. You know, you don't win tenders based on good news stories, you know, and we all have them, and we can talk about clients and families and the paths that they've taken and the really great outcomes, but without this evaluation and the data, it kind of doesn't mean anything, unfortunately. So I think the evaluation has helped us, like I said, get an idea of, okay, how do we, like I said, present this in a better way that we have those good news stories that kind of touch you emotionally, but then that has the data and the evidence to back that up as well. So we can look at ongoing funding opportunities.
So is some of what you're sharing how to present it? Like, is that kind of a learning that you're thinking across the organisation?
Yeah, I think so. Like I said, drug and alcohol, you're funded by targets, you know, and any time we take away from that, you kind of start missing your targets, and that results in, you know, pressure on funding as well. So it's a really fine balance, I think, in drug and alcohol, doing family work, which we're absolutely invested in, but it is a fine balance. We have to really think carefully about how we do that and who we use to look at doing evaluations, because as Mish said, the time invested, we had 3 staff who have routine jobs as well. That's just something that has to be a strong consideration.
And Mish, when you were doing the boot camp and then you got your findings, what have you shared with the organisation in terms of, you should stop doing this, we found this didn't work, or you should start doing this, we found this worked, or we want to start, you know, we think you should start collecting data in this way? Is there anything you can...
Yeah, there were a couple of things. One was, so we talked about in our presentation the recommendations we made. And the biggest one was continue to collect data in a way that makes sense. We use the same system as Keryn in terms of data collection, and I think in terms of what to stop or what to do and things like that, I think the biggest one that we were talking about was, how do we think about the outcomes of our programs? So not just I have X amount of DTAUs or I have X amount of hours or, you know, stuff like that, but why do I go visit a person in their house, you know, and really thinking about data also in terms of the logic of the program and the outcomes we want to have rather than just the amount of hours, etc. And so when we're thinking about what we share with the organisation, it's very much around clinicians are incredibly passionate about what they do, and what's built into the program that we sit under is a peer support role that works with family and friends. So, you know, incredibly passionate people, and I think to say on top of that, hey, let's evaluate and actually figure out what we're doing and why we're doing it, I think people are excited about that. But like I said before, it seems too big. It seems almost impossible. It seems like, you know, and even when I really enjoyed doing the theory of change, I was so excited to do it. I was like doing little boxes. I was very happy. But, you know, people, it takes away, and it's a real shift. You have to shift away from clinical work to think about this. And so I think one of the things we would take to the organisation, and one of the recommendations actually, was allow protected time where people can just sit and think. And I think Rob talked about that, or someone talked about that, around just allow time to think, you know, and supply Tim Tams if you need to. But like, I think that's really what we want to talk to the organisation about.
Yep, does take time and headspace.
Yep.
But maybe it'll be easier each time you do it.
Is that true?
Marginally.
Okay.
Easy evidence.
Maddie, is there anything that you've learnt that you've shared more broadly in your organisation?
I think for us, there are things that we've shared, but it's a journey for us, and I think that it's more around that mindset shift of getting people into their headspace of knowing that evaluation is important and knowing that surveys are important. And yes, it might be annoying and it might be an extra thing you have to remember how to do, but how do you judge if your program is actually doing what you want it to do if you're not doing that? And so for us, we're very excited. A lot of our team were watching G's presentation today and celebrating with her and the hard work that she's done about this particular program. And for us, it really is a long-term journey now around how do we shift that focus from delivering one program is great and having the anecdotal quotes from families and young carers is amazing, but what is the long-term result of that program, and what do we need to change to make that program a sustainable one and one that provides long-term impact? And so that's the journey that we're now going on, and I'm actually really excited about it. And I think that this project has shown the team how important that is, and it's been kind of the springboard that we needed.
Yeah, having this presentation makes it all worthwhile. It's the gift at the end.
Yeah, exactly.
All your hard work.
Exactly.
And Brett, what have you shared more widely in your organisation?
Regarding this particular...
Regarding what you learnt through the last 9 months you spent with us.
Well, I suppose just in regards to the evaluation itself and the outcomes from the evaluation, just sharing that within the organisation, to the executive, to the board, in order to try to engender that we can measure outcomes, that's important, and those sorts of things. It's a little bit difficult because the program ceases in September and the funding ceases, and there's probably not going to be ongoing funding, even though it's got positive outcomes. We'll share that with the funders, the funding body, which is Gippsland PHN, and it may end up with further funding, but if it doesn't, at least it'll really assist that planning group to look at sort of like the needs and some ways of addressing and supporting people in the region. So I think there's that aspect. And again, just from an overall evaluation approach, like I said, we've shared stuff internally, but we're also hoping to then share that externally on our website with our clients or participants, and also with our lived experience panel. So we've got a lived experience panel, so to really go through the outcomes with them and the recommendations that came from the report, and what are the best ways of implementing this across the board. Because one of our sorry, there's a 2-minute. One of the things our workers have been starting to do now is, knowing that there's probably not going to be ongoing funding, and knowing the outcomes of this program, is trying to work with other areas within the organisation about so that they can actually start working with families, as well as not necessarily needing a specialist program. So that's another thing that's come from the process.
And so, just go to the final question, because I know we've only got 2 minutes. So, you've been through this experience, you've learnt some things about your service. What are the gaps that you want to learn more about now? Like, what's the next thing that you think you need to find out? And if you could do it again, I guess, what would you do differently?
Well, we would have simplified from the very beginning,
yeah.
And not wasted a few, probably months worth of work and tears and upset. But I think one of the things is starting to really look at the long-term impact of the program. Yeah, we've got some really good outcomes that you measure, and a lot of the people that undertook some of the measurements were still involved in the program. So there's that residual impact that's still there. So I think once people leave the program, and doing some longer term follow-up, I think is really important for us to really see whether the program has an impact. We also didn't look at sort of like the impact of on the actual person's loved one that's using substances.
Yeah.
So we'd really love to look at that.
Would you guys agree with long-term impact being a key priority, and any others?
I was going to say barriers to access as well. Yeah.
Yep. I think that's a really important point. It seems like a lot of people had struggled to get enough people into their program, and so there might be some questions to explore next time around barriers. Yeah.
And I think one of the questions that I'm not sure anyone had the answer to is just the diverse populations. I think if we looked at the demographics of people that came into all of our programs, I'm certain there'd be a very small margin of this is who the people are that we're seeing. So, diverse populations is an area that we we haven't been successful at. Yeah.
Great. We'll see the next lot of evaluations come
Won't
out.
be me. I've loved this.
Do we have any questions?
Hello everyone, thank you. Sue Pope from Cunarda in Queensland. My head goes, I don't know, we've talked about funding a lot. My head stays there because that's the thing from an advocacy perspective that we're always talking about. This work is super important in terms of, as you've all highlighted, allowing us to demonstrate the value of the work, but also it helps us to learn and improve. So in a sector like ours that's so significantly underfunded, and all of the, from the AOD specialist treatment service perspective, those services do far more work than they're funded for. And that's not even considering this kind of evaluation and kind of continuous improvement opportunities. My head goes to what, and maybe this is a question for Keryn perhaps, what are the opportunities now for us to leverage this work in terms of our advocacy to government around appropriate levels of funding, but also appropriate contracting arrangements for services, AOD specialist treatment services, but also the awesome work that you're all doing with friends and families of people who are experiencing difficulties. So I don't know if anyone has the answer. That's probably pretty big.
Thanks, Keryn.
I do not have the answer to that question. I don't think I do. And maybe just given the timing, I think in AOD where, it gets to almost budget time and there's money that we've got to pull from different places, so maybe it's good timing. Maybe it's, utilising students, a lot better, and I only say that at the moment, as an example, we have students that maybe can take the place of some of the tasks of our clinicians, and they could step in and look at doing some of this. I wish I had a better idea or understanding of how to get funding for these positions, but I think at the moment what we're working with is the ability to just kind of work with what we've got, utilise the things we have at hand, which, like I said, may be utilising students in research placements, etc., a lot better than we have in the past. Knowing now what we do from Kantar and having some of those tools, we've only used students in a kind of direct client sort of perspective, previously, but again, maybe we need to shift our practice and look at some of those students who are interested in this, and, like I said, using some of the information we have now. But that's all I have for now. Sorry.
Any other thoughts?
We'll talk to that, but conscious of time, so thank you to the panellists, and I think it was a great question, Sue, to finish on, because the questions that I wanted to ask the panel were, we've had this moment where we had some additional resource to support evaluation capacity, and in listening to you this morning, there's three things that sort of struck me. One is it's been invaluable. It's really helped build capacity, it's helped build a case for support, it's helped demonstrate what's working, and it's raised more questions than it's answered, not unexpected. So what are the ideas, and I'm not suggesting we answer these questions now, but we will talk to people who've been participating in this process about these questions. What are the opportunities to create mechanisms that help embed this into the everyday, that help make it easier for it not to be a time demand that we just don't have time for, that draws us away from delivering the support we want to, knowing that we're always going to have to quarantine time for evaluation, but what can make it easier? So one of the questions for all of you to think about is, how do we make this more everyday? How do we connect relationships? We're going to hear from the research grant recipients this afternoon. Is there an opportunity to broker relationships between those groups as well? And then the other thing that struck me, and it came up, I think, again in this panel, was this evaluation was all about evaluating the impact with the people who are already using our service, but we know that there are a huge number of people in particularly hard to reach groups who need the service who aren't accessing it. So how do we understand why they're not? And I think we've done research at the beginning of this program. You've got some insights. How do we create tools and resources that make it easier for you at a local level to reach into those hard to reach groups at the right time in the right place? Social media, as you've all said, has been great for raising awareness, but it's not at the right time at the right place. And the Path to Help work that we've been doing, the insights we're gathering from that, the insights that you've got, might help us start to build resources and tools that you can use to start to connect into people. And then I think going to your question, Sue, when I talked this morning about the importance of evaluation, it really was, it's not just knowing that what we do works, because it's important that we're using our resources and our time and the connection with people who need support in the right way. It's their time as much as our time. So it's partly about that, but it's partly about really building the case. And so I've heard many of you talk about funding's coming to an end, we're concerned about contracts, we haven't got long-term funding. So how do we help you turn these stories into something that are meaningful for funders, and how do we bring them together into sort of a greater case for support for these sorts of services across the country that are more readily available to people who need them and in the groups that we're talking about. So there's lots of thinking I think that the ADF needs to do, but it's not thinking that we can do alone. We definitely need to be doing it with you. So I know we're all time poor, we're all resource poor, but certainly from this morning's session, listening to how much these capacity building grants have really helped do what we wanted them to do. They've helped build capacity, they've helped increase knowledge, skills, time, networks. They've set in place some processes that will continue, but they've raised some issues that we need to think about going forward. I just would like to commend you all for an enormous amount of work in a really short time frame under exceptional circumstances. Thank you for your time. Thank Kantar for their support. It's been a great process, and we will come back to this at the end of the day.